Thank you very much. I appreciate your patience, and what a lovely introduction. Thank you. There were some really nice presentations that I've just actually got to sit and have a listen to. And I think, some of the work that's being presented here at this conference is really lovely. So thank you for allowing us the space to kind of look into these things. So just by way of very quickly introducing myself. So I'm Kirstie Northfield. I'm a PhD candidate, very close to joining the Doctors Club that Tracy just spoke about. That's quite an exciting moment that's not far down the track for me. Thank you also, Tracy, for commenting on the importance of this idea of an acknowledgement to country. It's something that we are doing here quite customarily now in Australia to really give respect. And I'd like to pay my respect to elders past, present and emerging, specifically on the land where I am here in Melbourne, which is where the Wurundjeri clan, it is kind of their land. And I really want to make specific reference to the First Nations holistic idea around health. And I think as health practitioners, fundamentally looking at mental health and wellbeing, I think we have a lot to learn from some of the really great things that they've been doing for many, many, many years before we got here. So just by way of just kind of introducing my topic area, I just want to float a question for you. I want to ask the question, how would you know if your teenage son or daughter was feeling low? How would you know if they were having a really hard day? What are some of the cues? What are some of the nonverbal or the social indicators that you might be looking out for? And I want to layer that with this question. What would we know is the difference between social or nonverbal indicators of low wellbeing and behaviours of a normally developing teenager? Recognising that those teenage years, there is lots of change that's going on, and we see lots of changes in their personalities, in their behaviours, in the way they communicate, the way that they eat, and the way that they sleep. So let me share with you a story. I have a teenage son, and when he was transitioning from primary school to high school, I saw all of the cues that I was told to look out for. His sleeping patterns changed, and he was no longer spending time with his old friends. At the same time, we were still having some great interactions that challenged all of the cues I mentioned, where we would chat more freely and even sometimes have a laugh together. With these mixed messages, I had no idea how he was feeling. I didn't know whether he was having some mental health challenges or whether he was just a normally developing teenager. Can anyone relate to this experience? So this is what really motivated my research journey. Based on the premise that parents and teachers are most often directing or guiding young people to support services, I wanted to understand how well equipped they are in making these types of judgments. So before I started my own research, I went to the literature, and I had to understand what work had already been done in this space. I conducted a systematic literature review using search terms such as proxy reporters, and I had to go digging to understand how accurately parents and teachers could make these judgments. First, I need to note that the accuracy of a proxy judge, so that would be a parent or a teacher making a judgment or making a referral or an appraisal of the adolescent's wellbeing, is evaluated by firstly asking a young person to complete a self-report survey of their wellbeing. At the same time as asking their parent or their teacher to complete this same survey with reference to their young person. Then the accuracy of that judgment is measured by seeing how closely those two reports match. And this level of match or this level of agreement is referred to as concordance. So as you can see in the slide here, I've highlighted some of the key findings from the systematic literature review. The conclusion that had been repeated across a collection of studies is that parent proxy reporters are best used as supplementary information to adolescents' own self-report when considering service referrals. Further, with very few evaluations being made of teacher reports, we were not able to draw any broad conclusions related to the accuracy of teachers' judgments. This challenges the current referral systems where parents and teachers often act as gatekeepers or guides. Some of the other interesting patterns that emerge from this review indicate that when considering specific domains of wellbeing, such as physical wellbeing, social and emotional wellbeing, or psychological wellbeing, Parent reports appear to be more accurate in observable domains. Further considering some predictors, we found some evidence that indicated that mothers, as compared with fathers, appear to be more accurate in emotional and psychological domains. And there was a couple of reports that indicated fathers were more able to make these judgments in the domain of physical well-being. Considering adolescents' age as a predictor of concordance between the adolescent and the parent reports, across the collection of studies, we couldn't draw linear relationships. Some studies indicated that the concordance increased as the young person got older. Other reports indicated that they actually decreased. I suspect after having gone through all of these reviews or all of these research papers, that it's more likely that what's actually being found here is that there's a curvy linear pattern where concordance will be its lowest in mid-adolescence, which aligns with the time that adolescents and parents report having the greatest amount of conflict within the familial relationships. And this is something that I will continue to investigate further as my research progresses. If you're interested in knowing any more about these patterns, this full review was published in the Journal of Children and Youth in about the middle of last year. So following this literature review, the next step in this research program was to actually go to the young person and ask them what it was that we were looking for. So using qualitative interviews, I went to the young people and I asked them, with whom do you share your low well-being and how do you communicate this message? On this slide, I give a brief overview of some of the methodology or some of the methods that were used within these interviews. I spoke with adolescents between the ages of 14 and 17 to find answers to these questions. Working with some guidelines previously employed by Professor Kerry Gibson and her team at the University of Auckland, I interviewed young people using the novel method of instant messaging. Specifically, I actually conducted these interviews through WhatsApp. By meeting these young people in their native space, the adolescents had a position of power within these interactions. It was up to them to choose how much or how little to share, and they were in full control of when the interview would be ended and the pace at which those comments were going backwards and forwards. The pressure of the face-to-face conversations and managing the behavioural, the non-verbal cues was taken out of the picture, and we were able to continue on with our conversation without being interrupted by, them trying to manage how they were looking as they were answering those questions. I was especially surprised by how verbose and detailed the messages were with their responses. I had expected single-word responses, similar to what I might have got from my son during those years. And I was genuinely surprised at how quickly these kids could type. With each interview, I took my time and I let the interviews progress naturally. Most of the interviews went well over the allocated 60 minutes, and some of the young people openly noted to me that they enjoyed our conversation. For a researcher working with teenagers, this was a massive praise. The added benefit of using these instant message interviews was that the transcription of the interview data was very quick. So from that transcription with that data, I went and I completed a thematic analysis, and a number of themes emerged from this information. So let's just have a look at what we learnt from these transcripts, from this data. Specifically, the key finding that come from this data was that young people actively choose who, when, and how they share their low feelings. And this relates to both their verbal and their non-verbal communications. Going a little bit further, one of the key things which I think is something that is going to be very usable in terms of how we can encourage more disclosure from young people is we establish from this information, speaking with them, is that in the case that receivers or the listeners or the proxy reporters can follow these simple rules of engagement, the young person is more likely to share more and to disclose more with the listener. And so these rules appear quite simple, but recognising the motivations between parties, they can be difficult to impart. Rule number 1 talks about giving the young person an opportunity to feel heard in the relationship between the young person and the listener. Rule number 2 refers to the sense that we have to listen without judgment. So don't judge them for what they're sharing, rather just listen and be a sounding board for that young person. Rule number 3 is listen without emotion. Don't get angry or sad with them. Some young people in these interviews spoke about not sharing feelings because they were afraid that mum or dad would get angry with them for what had happened that had made them feel low. They further went on to say that they don't want mum or dad to worry, and the last thing they wanted was for mum or dad to feel more sad as a result of them sharing their feelings. Rule number 4 was an interesting, and it refers specifically to respecting the privacy of the young person. And this refers firstly to this sense of ownership. It's their information, and they very clearly made it quite apparent that the choice of how much they share was completely up to them. And so here we refer to this idea of not asking for more information than what the young person is willing to give in that moment. And an extension of this rule refers to this idea of they're sharing their information with you, and in no case can you go ahead and share that information with others. Rule number 5 refers to listening to your young person without offering solutions. Again, they're not looking for their listeners to give them the answers or to fix their problems. They want to maintain agency in dealing with their own challenges. They're just looking for their parent or their teacher to listen to them. So here we recognise the challenge that exists with these applying these rules. As a parent, we're biologically motivated to take care of our young people, but it is important that we keep coming back and referring to these rules as we're allowing our young people to open up to us. So now digging a little bit further, I'm going to unpack some of these relationship-specific situations in which young people may be sharing their feelings. I found some interesting differences in how young people refer to their interactions with parents. Some of this content was particularly challenging for me as a mother, as I can consistently across interviews, young people spoke about giving mum the opportunity to feel heard and to see, and here I refer back to the first rule of engagement, that is creating an opportunity for young people to feel heard. It seems that mum can do that fairly well. However, often their comments indicated that mum may not follow the later rules, that they may leave this interaction feeling like mum is judging them, or perhaps that mum has shared her own feelings, or she would try to offer solutions and help their young person to resolve their problems. Here, some of the comments that were made indicated that after disclosing my feelings to mum, I would leave feeling more irritated, or maybe my mum's reactions would make me feel worse. I've put some of these comments on the screen for you to share with you all here. In relation to dads, this was an interesting story and was less consistent than the comments that were made around how they go about sharing feelings with mum. Some young people commented that dad would notice more about how they're feeling, indicating that they share more of their non-verbal communication. However, dad was less likely to ask about their feelings, and the young people were less likely to verbally disclose their feelings with dad. Now, considering friends, when talking to the young people about their interactions with friends, it was clear that on the whole, friends are their safe space. Noting that most often they would share their low feelings both verbally and non-verbally with their friends. However, going back to those rules of engagement again, there were exceptions to when they would share with their friends and which friends they would choose to share with. As we may expect, if the specific friend is the reason for their low feelings, a number of teenagers noted that I would choose a different friend in that moment. Also, if they felt the friend that would judge them, or they felt that their friend would use that interaction or that opportunity to share their own feelings, they would choose not to disclose. There are also comments that indicated that they often would consider their friends' low feelings before sharing their own, noting that they didn't want to make their friend's day harder or more challenging. I also found it interesting to see through these interview transcripts that communicating with friends online or in games was not a barrier to that sense of having a sense that they could feel that their friends would be able to listen to them and understand what they were feeling. A few young people I interviewed noted that their best friend, who now lives far away, still knows how I'm feeling, even when we're only online playing games. And here I can personally attest to the sense of that non-verbal sharing that I had in these instant messenger interviews. It gave me some insight when I reflect on these interviews that I had, where they were using the pace of their responses. They were sometimes using capital letters or they were using full stops. But I was very surprised that most often they weren't using things such as emojis or many acronyms. I was surprised to see that most of the interview responses that I was getting were very long and carefully crafted sentences. Now, considering the teachers, some of the comments that young people made to me allowed me to conclude that in general, and look, there are some exceptions to this rule, young people note that their relationships with teachers is more businesslike, and they're not likely to verbally disclose their feelings with teachers. Again, here I refer back to this first rule of engagement and suggest that young people may not perceive an opportunity to feel heard with their teachers, recognizing there's not the closeness but in those interactions or in those relationships. And some of the comments that indicate this was such that I feel teachers are too busy, or I only see them once or twice a week, or we're in a really big class. However, it seems that the school environment creates an opportunity for teachers to see how young people may be feeling. And they may, in fact, benefit from the young people not feeling an opportunity to feel heard. Let me explain. Bear with me here. At school, young people told me that I'm often with my friends. And so when I'm with my friends, I can be my neutral self. I don't need to hide my feelings when I'm with my friends. Then, where young people are not judging the teacher-student interaction as being one to share feelings, they're not choosing to hide or self-manage their nonverbal cues of low feelings, as they may be doing selectively with their parents or other adults. So it's possible that by the nature of the school environment where young people feel safe, teachers have the golden opportunity to see how young people are feeling, more so than hearing how they're feeling through their verbal disclosures. More work is planned to investigate these hypotheses in future. Now, going back to where we started this conversation and what would our young people look like if they were feeling low. So thinking about these nonverbal cues, I asked young people what nonverbal cues would indicate low feelings for you. Here I asked them things like, how would you appear if you were feeling low? Or what would you look like if you were feeling low? And then I asked them about their friends. How would your friends look? I needed to triangulate these terms to get an idea if these terms or these nonverbal cues applied generally across teenagers, or if it was just something I was hearing and maybe seeing in the individual that I was speaking with. I've collated a collection of common examples that come up through those conversations. Here you can see young people noted looking tired, distracted, zoning out, spending time alone, or perhaps ignoring people. The challenge here, as you can see in this list, is applying these cues would be especially difficult if your teenage son or daughter is quiet, reserved, or generally enjoys their own company. And this might be by the nature of their personality characteristics or how they like to spend their time. And this illustrates the challenge of identifying a typically quiet or reserved young person who may be feeling low. The quote I've noted on the bottom of this slide captures this point perfectly, where one young person noted, she's usually happy and smiling, so mum would notice if I'm smiling. This same young person explained to me that in contrast, she had a friend who was generally fairly quiet, and she explained that when he opened up and told her that he was depressed, he'd already been seeing a psychologist for quite a few months. She said she would not have known because he didn't look any different, highlighting the floor effect that we may be dealing with when we're considering these cues or these nonverbal disclosures of low feelings. Aligned with this commentary and other research that unpacks nonverbal cues of low wellbeing, this slide highlights the importance to consider changes in behaviour or changes in presentations of young people, while also being aware that these changes may be harder to recognise in some people, where the difference between a good and a bad day may not appear particularly differently. So this takes us back to the first question that I asked at the beginning of this presentation. How would you know if your young person is feeling low? And what is the difference between a typically developing teenager and a teenager who's showing their feelings? And the answer to this question is seeing differences and creating opportunities for young people to verbally and non-verbally share their feelings with you. So just by way of kind of going back through and considering the takeaway messages or the key points that we found from this research, the first one is that overwhelmingly adolescents made it very clear that they choose whom and how they share their low feelings. Friends are their safe space where young people feel comfortable to share their feelings. For parents, considering the rules of engagement may encourage more disclosure from their adolescent children. For teachers, they have the benefit of seeing young people in their safe spaces alongside their friends. And finally, the quiet young people are much harder to identify. So just recapping on these rules of engagement, and these are particularly important when we're wanting our young people to open up to us. Firstly, we need to create an opportunity for the young person to feel heard. So this talks about the relationship and the interaction. We need to listen to our young people without judgment. We need to listen without emotion, so we can't get sad or angry with them, not in that moment. Number 4 talks about respecting their privacy and understanding that they have ownership over their feelings and ownership over their information. And finally, we need to listen to our young people without offering solutions. It's up to them to maintain agency and share how much of what they want to share with us. And finally, just to kind of put this into context, here I've presented on 2 of the steps of my research with relation to adolescent wellbeing and whether parents and teachers can be making these assessments. I'm very close to completing the final phase of this research where I've measured the concordance or the level of agreement between adolescents and their parent reports and also their teacher reports. And I'm hoping to have a couple of papers completed. One is under review at the moment by the middle of next year. So if you're interested in following that information, I'd be very happy to connect with you on LinkedIn or through ResearchGate perhaps. And here are my contact details, and I'm happy to take any questions from the group.
Thank you, Kirstie, for that lecture. And of course, now we know that when we listen to our adolescents, when we to be there for them, just really listen without judgment. So that's very important. Do you have other questions? Do you have questions from our audience? Tracy has a question. Go ahead.
Thank you.
Thank you so much, Kirstie, for that wonderful presentation. And also, I'm so excited for you to finish your PhD. It's great on the other side. But I recently came across a study that was talking about family conflict being a consistent predictor for psychological distress for young people. And I really particularly enjoyed the rules of engagement that you listed because that's a great tenet for any relationship. So I was wondering, what are some practical strategies that you would suggest for parents, particularly who are not used to that style of interacting with their young people? How would you suggest that they maybe approach those rules of engagement and actually implement them in their relationship?
Yeah, look, I would probably say, and this is going a little outside of the scope of my research, but this probably touches on some of the clinical and some of the teaching work that I do. And I would say that for families, particularly where we're dealing with children and adolescents in particular, who are dealing with the challenge of navigating adolescence, is just to have an understanding that they're working through a whole lot of changes, and we have to give them some agency and allow them almost to invite us into that space. And that can be particularly challenging. You know, I've had some very difficult personal experiences with my own family. But it talks about this idea of being available. And again, you know, touching back on the stuff that you spoke about, Tracy, you know, creating that space and having the courage to sit with some of those really uncomfortable conversations and not have a knee-jerk reaction. I think for parents, one of the biggest challenges is we have this really big motivation to help our young people, so it can be quite difficult for us to try and put some of our own emotions and some of our own very quick responses at bay and actually just be able to sit and listen and allow them to share as much as they're prepared to.
Thank you, Kirstie. Can I ask one more question?
Yeah, absolutely. Please.
Because I really loved your data collection strategy, and I thought that was quite innovative. Were
Yeah.
there any limitations, I suppose, with the interviews being via text?
Limitations. Look, I would probably not say limitations per se. Look, I had some interesting challenges dealing with some of the ethical protocols and the considerations around that, particularly given that I was talking to young people. And in addition to that, talking about wellbeing, which is a sensitive area. So I had to be particularly careful as to when I conducted those interviews. And we had to carefully upfront, kind of recognize and understand that I wasn't able to give them immediate support if it was needed. So, we quickly gave them access to all of those really good support systems that were available online to them. And I'd probably say that would be the biggest challenge. But look, most of the conversations were really free flowing and they were really genuinely enjoyable conversations. It took me a moment to get into them and to kind of slow my pace because they're very quick. But yeah, they were really lovely interviews. And I'd be very happy to share some more of that information if you wanted to reach out to me. You've got my email there on the screen.
Yes, thank you so much, Kirstie.
Absolute pleasure.
Other questions? So if there are no more questions, Kirstie, once again, thank you for a very wonderful presentation. So now